In this video, we will be demonstrating the Canadian Occupational Performance Measure, also known as the COPM. The COPM is a semi-structured interview that is client-centered. It allows the clients to identify areas they struggle with in their everyday life to determine what they would like to work on in therapy. Reassessment allows us to measure performance and satisfaction over time after a few sessions of therapy. This assessment should be performed in a quiet, distraction-free environment, and the assessment should flow like a conversation. Our client today is a bakery owner named Kelly. She recently fell and broke her wrist and has just been cleared to begin hand therapy with an occupational therapist. She complains of weakness and pain in her right wrist that makes everyday activities difficult.
Hi, my name is Marissa. I'm going to be the occupational therapy student giving you your assessment today. What name would you prefer I call you?
Kelly's fine.
Okay, so we're going to call you Kelly. And what is your last name, Kelly?
Ready.
Can you please spell that for me?
R-E-A-D-Y.
All right, Miss Kelly. And what is your date of birth?
4/15/72.
On the first page of the assessment form, the client's name and date of birth should be documented, as well as the date of the initial assessment and reassessment when administered. In step 1 of COPM, we will identify problems Kelly is having in 3 categories: self-care, productivity, and leisure. This part of the assessment is completed by the therapist asking questions about the client's normal daily routines, including what they need to do, want to do, and are required to do. Each category is further broken down into subcategories. Self-care is broken down into personal care, functional mobility, and community management. This section includes how the client gets around, dressing, showering, and other activities of daily living. The productivity category is further broken down into work, household management, school, and play. This section includes cooking, cleaning, housework, and any paid or unpaid employment, including volunteer work. The leisure section is broken down into quiet recreation, active recreation, and social participation. This section includes reading, exercising, and social interaction.
Hi, my name is Marissa. I'm going to be the occupational therapy student giving you your assessment today. What name would you prefer I call you?
Kelly's fine.
Okay, so we're going to call you Kelly. And what is your last name, Kelly?
Ready.
Can you please spell that for me?
R-E-A-D-Y.
All right, Miss Kelly. And what is your date of birth?
4/15/72.
All right. Okay, Miss Kelly, can you tell me a little bit about what's been going on? I know that it seems like you've been having some issues with your wrist.
I broke my wrist, my right wrist, and I'm a baker, and now I'm healing, but I'm still having some issues. So when I'm stirring, just having some pain, it hurts to twist, move, different things.
Okay. All right, so I know you were talking to me about how it's giving you issues at work. Is there anything at home that's bothering you with it, such as like when you're getting dressed, taking care of yourself?
Sometimes getting dressed, it hurts. Depends on the movement that I have to use it. So back and forth, sometimes and up and down when I'm doing my buttons, or a zipper sometimes. Shoes.
moving around your house?
As freely as far as I move, I walk independently.
Okay. What issues are you having, like with household maintenance, doing chores, anything like that at home?
Not too many issues.
Okay. All right. Is there anything else that you can think of that, is an area of concern that's been difficult for you?
No, just some lifting with just my hand, just the weakness in my hand.
Okay. All right. So it looks like, there's a few areas that we can work on in therapy for you.
From an interview with Kelly, the therapist determined she is struggling with dressing her upper extremity, any movements that require twisting her wrist, and functioning at work. The main functional tasks that are challenging at work are mixing or stirring, decorating, and lifting. These problems identified should be documented on the assessment form on the lines provided in each subcategory. In Step 2 of COPM, the client is asked to rate how important each task is for them to be able to do. Each task is rated on a scale of 1 to 10, with 1 being the least important and 10 being the most important. This allows the therapist to create goals based on what the client perceives to be the most important activities to them.
So now I would like you to rate those on a scale of 1 to 10. So just on how important it is that you're able to get back to doing this as quickly as possible. So a 10 would be it's extremely, extremely important, and then a 1 is not important at all, okay? So I know you mentioned when it comes to dressing your upper body with those buttons and the zippers are giving you trouble. So on a scale of 1 to 10, how important would you say that is to you?
It's a 10.
A 10. Okay. And I know you did say that you were having issues with just basic functioning with your wrist, like twisting and just like using it. So I'm sure you're probably having some weakness.
Right.
Is that correct?
Yes.
Okay. So how important is it to you that you get that back?
A 10, but I could go an 8 with that. I could lose a little.
Okay. All right. And then so you're functioning at work. So you said you're a business owner, you own your bakery.
Yes.
So how important is that to you?
That's definitely a 10.
Okay.
Kelly rated all 3 problems a 10, which means they are very important for her to be successful in. Although her wrist pain and mobility limit her ability to complete these activities, therapy will focus on interventions to improve her performance in these tasks. Next, we will determine the specific problems for further scoring. The client is able to pick 5 of the most important issues discussed in the interview to work on during therapy and score for performance and satisfaction. After determining the client's top 5 problems, the therapist transfers them to the score sheet for further scoring and comparison. This sheet is found on the back cover of the COPM assessment form. After selecting 5 problems for further scoring, the therapist will ask the client to rate each problem based on how well they perceive themselves to perform the activity and how satisfied they are with their performance. This step also uses a 1 to 10 scale, with 1 indicating poor performance and low satisfaction with performance, and 10 indicating very good performance and high satisfaction with performance. These scores will be averaged and used to compare the discussed problems upon reassessment.
All right. So now looking at the 3 things that you have mentioned that you really want to focus on in therapy, I'm also going to have you rate them on your current performance while doing them, and then how satisfied you are with with where you're performing. So a 10 is going to be that you're very satisfied, and then a 1 would be you're not satisfied at all or you're not performing well at all. Okay. So performance wise, for addressing your upper body, where would you say you are now?
Probably about a 5.
About a 5. Okay, and how satisfied are you with that performance?
About a 2.
Okay. And so your movements and the weakness or the strength, where would you say you are performing wise with your wrist?
Probably about a 3.
3. Okay, and how satisfied are you with
About
this?
a 1.
Okay, and now when it comes to your job at work at the bakery, your performance?
About a 1.
A 1, okay, and how satisfied are you with this?
A 1.
Well, all right, Miss Kelly, I have everything that I need. I'm going to give this information to the OT, and then they're going to be able to start developing an intervention plan for you. And, hopefully we're going to make some improvements on that wrist and you can get back to doing what you want, okay?
Okay, great.
Okay, thank you so much.
Thank you.
For initial scoring, the therapist will total the performance scores and divide by the number of problems identified to create an average score. The therapist will do the same for the satisfaction scores to create an average. These scores will be used for comparison at reassessment. In Kelly's case, she is not very satisfied with her performance, especially in functional tasks at work because of her wrist fracture. She is not satisfied with her performance in these tasks because she needs to be able to do them and is expected to run her bakery. Her performance scores added up to be 9. We divide this number by the number of problems identified, which is 3, to get an average score of 3. We repeat this process with the satisfaction scores to get a 4 in total satisfaction and a 1.3 for total satisfaction average. The initial scores are recorded in the T1 boxes of the assessment form, and at her initial assessment, the therapist also made notes on her wrist weakness and functional limitations that inhibit her performance. The last step of the COPM is reassessment. In this step, the therapist reassesses the client at an agreed-upon time to track progress. Performance and satisfaction are rated again to compare to the initial assessment. These scores are documented in the T2 boxes on the assessment form. Each score is added to yield a total performance and satisfaction score, and the totals are again divided by the number of problems identified to yield an average score. These scores are then used to determine the change of scores by subtracting the initial score from the score found at reassessment. A change of 2 is considered clinically significant. These scores are used to determine if the client is improving and therapy is beneficial.
Hi, Kelly.
Hi, Marissa.
Nice to see you again.
You too.
Okay, so it has been 4 weeks since our last assessment.
Yes.
So now we are just going to go through this again, and I'm going to ask you about the areas that you wanted to focus on in therapy. So that's going to be the dressing of your upper extremity, just your functional movements and mobility with your wrist, as well as how you're performing at work.
Okay.
So if you remember that scale we used, the 1 to 10 previously, for your performance and your satisfaction while doing those tasks, I'm going to go through and ask you those again. So when it comes to dressing your upper extremity, how would you rate your performance with this now?
About an 8.
And how is your satisfaction with doing this?
Probably about a 6.
Okay. And so that functional movements and mobility of your wrist, how would you rate your current performance now?
About a 6 now.
And your satisfaction with this?
Probably about a 7.
Okay. All right. And at work at your bakery, how would you rate your performance?
That has improved greatly. I'd say about a 7.
Okay, 7. All right. And your satisfaction with this?
That as well at a 6.
Okay, so we still definitely have room for improvement. Thank you so much for your time and for coming. And Kelly, I really appreciate it. If you have any questions, just please let me know, okay?
Okay, thank you.
Kelly and the therapist agreed to reassess her problems after 4 weeks of therapy. Upon reassessment, Kelly seems to have improved with wrist strength and mobility from therapy. She rated her performance and satisfaction high in each problem to yield an average performance score of 7 and an average satisfaction score of 6.3. She has shown significant improvements in therapy with a change in performance score of 4 and a change in satisfaction of 5.